Another part that we keep hearing is that there's a lot of talk around AI. There's, expectations at the C level to adopt artificial intelligence and implement it into clinical workflows. But with the, multitude of solutions available, with all the different pathways, the ways of thinking about it, there's oftentimes a bit of a struggle. So, many have started to put together AI strategies, AI governance committees on how they're going to, wisely adopt these solutions within practice, within their institutions and work with them. I think this is a great opportunity, for radiologists to engage there and serve on those committees as, key voices and insights. So, radiologists can really start to take the reins. But going back, remind you, 531, it's rife with analysis paralysis. There's so many things to do, so many different ways to think about, so many different ways to approach it, that frankly, taking that first step can be one of the most complicated ones that you'll take, as a healthcare system, as leaders within your clinical communities. So really finding a way to be able to integrate these well, work well with the solutions, consider the clinical workflows in the radiology department, but also the interfaces with the multidisciplinary teams that lie within your institutions and, are oftentimes, engaged closely with the radiologists on the patient's clinical pathways, can be quite complex. So what I thought would be helpful is to kind of break down a few different approaches to the adoption of artificial intelligence that we've seen emerge over the past, 7, 8 years as we've grown as a company. First is the point solutions. That's where we started. Initially, we had a solution that, worked with the radiologist. It was one clearance to start with, intracranial hemorrhage. But, quickly our path grew up to, 15 FDA cleared solutions now. Oftentimes implementing these has a, lower, cost, but it's targeted towards a single solution. It's targeted towards a single clinical user oftentimes. The marketplaces have also been around as a concept for quite some time, but they're generally just focused on, again, a single clinical use case being applied within a single clinical department over and over and over again. They tend to be overly broad. It's difficult to monitor solutions within this. And when you consider how to apply the artificial intelligence within the workflows, you're limited. Another area that, we've really pioneered and started to, consider when working on these clinical implementations is the, enterprise platform. So being able to recognize that radiologists are the center of so many of these pathways. Imaging is ultimately, what the bedside physicians are waiting on, what the interventionalists are waiting on before they do any procedures, even before they engage, deeply with the patient on their care plan journey. So providing a scalable solution that's able to take all these different inputs, all these different solutions, implement it seamlessly into the native workflow, recognizing that not every user is going to have the same interface, the same method of interacting with these solutions. Providing a very secure environment upon which all of this can be launched and integrated, that's able to, balance HIPAA, high tech, other, regulatory frameworks out there, from a security perspective, and, really be able to monitor the performance closely, make sure that these solutions are running well, make sure that the radiologists are seeing value, make sure that the multidisciplinary teams are being engaged in a thoughtful way, leveraging the multiple workflows that are out there, to really engage those multidisciplinary teams.